You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian nutritionist and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor. We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen.
Dr. Tiffany Troso-Sandoval is a double board certified medical oncologist with over 25 years of experience specializing in breast and gynecologic cancers at Memorial Sloan Kettering Cancer Center in New York. Now the founder of Winning the Cancer Journey in the Second Look Oncology. She's also the host of the Empowered Patient podcast, where she spotlights conversations that transform the doctor-patient dynamic. Welcome, Dr. Troso.
Thank you so much for having me. I'm honored to be here.
Can you define your role as a medical concierge?
Sure. Being a medical oncology concierge physician has allowed me to really work with patients on a one-on-one type of a situation where I have as much time as I need and as much time as the patient needs to really understand in depth their treatments, their options, how to best manage their side effects and symptoms, and how to make decisions. The other thing I help them with is to help define how best to communicate with their physician and how to have the conversations with their physician where perhaps they're not agreeing with the particular recommendation that their physician is providing them. So I help them to really have an in-depth understanding of what they are choosing between so that they can have on-point conversations with their own doctor. Because one of the beauty of being a concierge medical oncologist is that I am providing second opinion. I'm providing support and a physician advocacy type of a position where the patient is learning and is becoming empowered to then work better with their own physician. So I am not providing any treatment, so to speak, but by being their support system and their concierge, I'm allowing them to get the best possible outcome from their treating physician.
You've created a role that sounds exactly like something me and my mom have talked about for years. There needs to be somebody who helps guide patients through this treatment process because it's so overwhelming to go through this. You don't know what any of the words mean the doctor's saying. So it's so great to hear that you're able to be in this space.
Yeah. The limitations are that there's only so many minutes and hours per day. And so how many patients can I actually be the concierge for? Which is why I am also developing an online course that people will be able to join a community and learn from this course. And then I'll have one-on-one time, which is not really one-on-one, it'd be one to a group, to really ask more questions so that you can thoroughly understand the material that I'm providing. One course is based on one of my new books, and the other course is based on my other book. So the first book that I'm putting out is it's basically an oncology 101, what a patient would know and understand from the moment that something has happened. So you have an abnormal mammogram, and where do you go from there? And I walk a patient through that as an expert, but speaking to a patient, layman, exactly everything that has to happen along that trajectory for them to get their best possible outcome. And, that includes, I review how to read a pathology report and what's the difference between an MRI and a PET scan and why would we use one instead of the other. I go through different types of treatments that we use, particularly for breast and gynecological cancers. I go through side effects. I go through how to discuss things with your physician. The second book is called The Empowered Patient. And that one is more of a mindset book where I am teaching patients how to best organize themselves psychologically as well as socially within their own stratosphere. So everybody has a million people that want to help them, and nobody knows how to help you. and nobody knows the words to use. And this book sort of walks you through organizing and systematizing your cancer care. One of the phrases I use is become the CEO of your own care. And I teach a patient how to empower themselves and how to empower others around them to help them in a strategic way.
Well, I wanted to maybe ask, has your consultative role as a medical concierge expanded? I guess another way to ask that, I know that you were board certified in breast and gynecological and cancers. Are those the particular population that you're working with, or is there an expanse in that role or responsibility?
Sure. So, what I usually how I usually answer that question is when it comes to giving a medical recommendation, a treatment recommendation, you should take chemotherapy ABC instead of DEF. I stay in my lane. I stay in breast and gynecological medical oncology, and this is what I know best and I'm an expert in. That being said, I am board certified in all of medical oncology, and theoretically, I can help guide anybody. So I've had patients, for example, that have had head and neck cancer, a male. I've had a patient that had pancreatic cancer, a male. And although I might not be specifically prescribing or recommending a certain line of treatment, I can still explain all of the other stuff that's there, right? So I can still review your PET scan. I can still review your treatment recommendations. I can still explain to you what the side effects are, what some of the other options are. We talk about genetics. There's so much to know besides just what the exact prescription for chemotherapy is. That yes, I can help anybody in the medical oncology field. Maybe not including leukemia and lymphomas. We consider those liquid tumors, and I'm not quite as attuned in those. But pretty much any solid tumor, I can help a patient guide them through their treatment as an advocate and as an expert. But coming short of just actually the prescription component of it.
Can you tell us about your public speaking engagements and the Empowered Patient podcast?
So, the Empowered Patient podcast, I just started a few months ago, and I've really, really enjoyed doing that. I've met some brilliant people, very engaging, interesting. I've learned so much. I've met people that I probably would never have spoken to otherwise. I look to basically speak with people that are moving and shaking things in the healthcare industry, and also as it pertains to oncology. So I have spoken to medical concierge primary care physicians. I've spoken to cancer advocates. I've spoken to patient survivors that have actually also had a very big impact on how other physicians practice medicine. I say that I like to talk to the movers and shakers in my niche, and it's been actually really, really interesting and very enjoyable to do. And I've grown significantly. I can't believe it. I grew from nothing to, I think I have, I don't know, 2,500 subscribers already. So in just a couple of months. So I'm pretty excited about that. And that's without really doing much advertising. I think it's just word of mouth and from maybe some of my other social media outlets. My public speaking has been probably limited more to specific topics in breast cancer, for example, or specific topics in oncology. I am really looking to expand out more into being able to speak about some of the mindset things that I was telling you about before, how to empower yourself as a patient. And I think that should be very interesting. Once I'm done publishing my books, my next goal is to get a TEDx talk. And so I'll circle back with you when I get there. So.
Well, that was something I wanted to ask some more questions about as well. Like you had mentioned that there's some courses that you would like to have based on your works, and wanted to see if you could just give us maybe like a sneak peek of the book that you're working on, or just some of those courses.
Can I bring something up and show you, share it to you on the screen? Am I able to do that?
I don't think it has the ability to just share screen.
Okay. No problem. So I can send it to you, and you can possibly even just put it in the show notes later. But
Yeah.
I have a content construct that basically looks at a cancer patient from the empowered patient as being the empowered patient as the goal. And I have a three-tier system where I help patients to learn how to plan, participate, and prepare for their treatment. This is part of that whole mindset and organizational platform. The areas of work that people need to do is to learn how to coordinate their own care, how to learn how to have a sense of calm and control and clarity. And so by each of those pillars really help patients to develop their own system in which they are creating their best cancer journey. And one of the titles of some of the things I do is called Winning the Cancer Journey. And some people say, well, you can't, what do you mean winning? You don't win cancer. What I mean by that is that by winning the journey, you're getting your best possible outcome in the best possible manner. And so I can't ever promise a patient that I can conquer their cancer and make it go away and never come back, but I can help make it the best, most fruitful experience that it could possibly be and help you get the best possible outcome that's
Mm.
available to you. And so that's really where that comes from. Not sure if I answered your question or not, but yeah.
I like that it's focusing on like the journey and not like the like you said the outcome or like the destination, and
Hmm.
it's more so about being able to have that I think one of the qualities you had you know identified is that clarity, that
Hmm.
calm, that ability to have maybe some emotional um, regulation or equanimity with
Hmm.
the process.
Hmm. And one of the basic tenets that I'm sure you've heard of before, but learn to control what you can control because we can't control everything. And decide where and when you're going to spend your emotional energy because that's within your control. So if you're waiting for your to see the doctor and you're waiting for your CAT scan and they're 2 hours behind and you didn't eat lunch and somebody's got to pick up your daughter and you weren't supposed to be there that long, you can lose your cookies and beat up the woman at the front desk and yell and scream and get yourself all worked up, or you can manage your emotional energy and either reschedule or what have you. I guess the point is that you get to choose how you're going to manage your own emotion and your own energy, and learning to let some of the things go or understand that this is par for the course, whether you like it or not, whether it's fair or not, I think allows a patient to have more control over their own personal environment, if that makes any sense. I hate to see patients lose control over things that are really not in their control to begin with. If that makes sense.
I really loved how you said winning the cancer journey because it's like earlier, Colin mentioned it's like, it's more about the journey and not the destination.
Mm,
And with cancer treatment, if you don't really know what the destination is, and there's like
right.
doctor visit after doctor visit, and from my personal experience, going to all these different medical providers became like a full time job during my
Hmm.
treatment. You're going like twice a week to the doctors and you're trying to make sense of it all and you don't there's the fear of that unknown
Right.
plus all of like the medical information that is being thrown at you when you're just like brand new to this world. You just feel kind of lost. You're like totally, for me, I was failing the cancer journey. I mean, obviously I got to my destination, but the whole journey was such a struggle to figure out how these medical systems work and how
Hmm.
to get to that positive outcome.
Sure. Yep. Yeah. That's that's very common. Hopefully we can help people not have to take the pathway that way. Help people make it a little bit smoother and easier so that it doesn't have to, because I'm sure in some perspectives you probably have some like a post-traumatic stress disorder from looking back at what went on, right?
Yeah.
And then you carry that with you for the rest of your life. And so I can't promise that you're going to walk away from cancer and be completely unscathed from it, but perhaps it doesn't have to be quite as difficult as it was for you, for example.
Yeah, and I love the part where you talked about mindset because I think what really carried me through all of this was that the whole time, my mom and my brother, my support system, is we were like, we just have to make a lot of jokes. Like we have to make this humorous. Like, and we had this joke about the MRI. You get an MRI machine and it's like this loud noise. That's like,
Hmm.
and you're in this like really narrow cavity. Like you go in, they put you in, and the
Yeah.
machine is like moo, moo, wee, and you're like, and you're thinking, how long am I going to be sitting in this narrow cavity? And it's like 45 minutes of just woo, 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 woo. And you're like, what is
Wait,
that?
you forgot about the bop, bop, bop. That there's that part too.
Yeah,
When they're
yeah,
finding the magnets, right?
yeah. So yeah, we made so many jokes that we were like, we could do stand up. We could do a stand up comedy for cancer survivors going through the treatment journey.
I like that.
That's going to be the audio clip for this episode. Just the MRI impressions right there. One thing you had shared is that there was, when you were at Memorial Sloan Kettering, a process of like having, 3 or 4 patients in a room. And like there was times when it was really hard to manage that and you had to like kind of have that reset. I
Yeah.
was curious, like, how does that look different for you as the medical concierge? And is there a different reset that you have now?
I mean, right now it's a completely different world, right? So I may only see 1 or 2 patients in an entire day. I'm not taking very many patients. I'm just taking, a few handful at a time that I can take really good care of. So it's very different. I wouldn't book. I try not to book patients back to back at this point either, so that I can actually help reset myself so that I'm the best. I can come with the best energy and intellect as possible. So I might have a patient in the morning, then maybe I go to Pilates and I have lunch and another cup of coffee, and then I have another patient, or I do a podcast or something. But it's the beauty of entrepreneurship, is that I set the schedule now. I'm in charge. And but that being said, I still have the burning desire, passion to take care of patients, right? And so even though I left clinical medicine, I haven't left my passion, and I haven't left my journey that I have described in terms of helping patients get their best possible outcome. And so I am still very, very committed to that, and I'm excited to be able to do it on my own terms. Luckily I'm fortunate in that I have some other means to make some money at this point, because if you can imagine, if you're only taking a couple of patients at a time, that's not probably enough to support my 2 kids in college and 1 in medical school. So I I've actually started doing some other things that help sort of pay the bills, so that I have the luxury to be able to take care of just a few patients and to be creating these books and these online courses. And so it's a little bit of a balancing act to make it all happen. And every once in a while I have to whip my husband like that, so he goes back to the operating room and does a few more surgeries to pay for our car insurance or something. But no, I'm just kidding. But it's a teamwork between he and I, and he's been extremely supportive of me, and it's been really, I couldn't have done it without him. So thank you, honey.
It almost sounds like a comparing like your role at Memorial Sloan Kettering and your role now is like apples and orange juice. Like they're completely different, and that there is more of that flexibility with your new role. Um,
And being in
so
touch with life, you know. I used to look out
yeah,
in between patients, I would look out the window and like just long to go outside and just take a walk for a couple of minutes. And, maybe once every 3 weeks, I would get a chance to do that. But usually, could barely had time to go to the bathroom or take a bite of the turkey sandwich on my desk in the back room. But now I finished seeing a patient. We finished filming a podcast. I go, I sit in the backyard and I pet my cat and I throw the ball for my dog. And it's like a whole other world right now. And I think that it helps me be a better person and a better doctor, because I feel more fulfilled, or more like I'm participating in the world around me. Whereas before I felt like I was in this like fluorescent light tomb that I was working in.
hmm. It sounds like the pace is quite different, but that it's affected your outlook and your mindset, or just have more opportunities to be mindful, to then be connected with
Mm.
what you're doing, to then show up how you want to show up.
Mhm. Yeah. Agree. Agree.
Being outside is really powerful. I think like near the end of one of my hospital stays that was like a whole month long, I just looked out the window and I was
Mhm.
like, wow, there's a whole world outside.
Yeah.
I can't wait
No,
to
I
get
know.
out there.
So what do you think about the whole credence of, like, your feet need to touch the ground outside, preferably without shoes? Have you heard about that?
Yeah,
Like, be
I love that.
grounded
Yeah, I love
outside?
that. I like to go to the beach
Mm.
and just like one of my physical therapists actually mentioned this. I was having a lot of pain in my feet, side effect of the chemo that's kind of like
Mhm.
kept stayed with me for the last 18 years. I'm in
Mm.
remission. And
Okay.
he's like, just go to the beach, put your feet in the water, like ground yourself. And I remember it being like really helpful. I would always
Mhm.
feel this like, I almost felt like the ocean water was washing away all my worries. And I just
I love
felt,
the beach.
yeah. Is there a beach you go to out in New York?
Yeah, I live on Long Island, and actually we have some of the most beautiful beaches in the world, believe it or not. I'm at Atlantic Beach, which is maybe 30, 40 minutes outside of Manhattan. Jones Beach, a lot of people have heard of. It's a big national state park beach, but it very fine white sand. The ocean is blue, green, brownish. It's not beautiful. It's not Caribbean looking, but the sand itself and the actual ocean breeze and the waves. I could just sit there. I could sit at the beach forever. In fact, I told my husband when I'm gone, that's where I want to be laid, somewhere at the beach.
Yeah, during my chemo treatment, my brother was like, we have to spend time outside. I read all these
Mm.
studies that were saying that it's really good to be outside.
Hmm.
So he would force me to go outside. And when you're doing chemo, you're so tired that you're like, I just want to be in my bed. When can we go home? No, this is
Oh.
really good. Stare at the trees. Take in the breeze.
It's true.
And yeah, it is. It's really powerful. There's like tree bathing. There's all kinds of research out there around like the power of just grounding and connecting to the earth.
Hmm.
And some people believe it helps us reset our circadian rhythms to like the earth. I don't know if that's true or not, but it's kind of
Hmm.
an interesting concept.
It is an interesting concept.
I think my happy place
Yeah.
during my treatment, while I was at the City of Hope for my bone marrow transplant, was just the Japanese garden. Going over and being able to see the koi pond, and then just sitting there and breathing it all in, being able to then really have that be a place for reflection and calm and peace.